Stop what you are doing right now and stick out your tongue. Look at it in a mirror or in your phone camera. I am completely serious. What you see on the surface of that organ in the next 30 seconds may tell you more about what is happening inside your body than any blood test your doctor ordered at your last annual physical. Not because this is mysticism, not because this is ancient folklore that has never been validated, but because the tongue is a living surface tissue supplied by some of the most dense vascular networks in the human body, directly connected through nerve pathways and circulatory channels to your liver, your kidneys, your gut, your cardiovascular system, and your immune response. And when those systems are in distress, the tongue shows it, often months before conventional diagnostic tools catch it. In this video, I'm going to show you 6 specific things you can see on your tongue right now that signal serious internal dysfunction happening in your body. Not all of them require panic, but all of them require your attention, because catching these signals early is the difference between a simple intervention and a crisis you could have prevented. Before I walk you through each sign, I want to be transparent about something. Everything I'm going to describe is grounded in both clinical medicine and in peer-reviewed research on what the tongue's appearance correlates with at the systemic level. Studies have found that tongue color analysis can achieve disease diagnosis accuracy rates approaching 92% across certain conditions. Your tongue is not just a muscle that helps you eat and speak. It is one of the most accessible and information-dense diagnostic surfaces on your body, and learning to read it takes less than a minute and costs nothing. If you want more of this type of direct evidence-based content that nobody else is giving you straight, subscribe right now and hit the bell. Every week I publish exactly this kind of information. The diagnostics, the mechanisms, the early warning signs that your routine medical appointments are too short to cover. Your health is not a 15-minute appointment. Now let us get into the 6 signs, and I want you to be actively looking at your tongue as I describe each one. The first sign is a thick white or yellowish coating that does not brush off. A healthy tongue has a thin, almost translucent, light white coating. That is normal. That thin coating is made of keratin, dead epithelial cells, and a small amount of bacterial film that your saliva constantly manages and your tongue naturally sheds. What is not normal is a thick, cottage cheese-like white coating, or a heavy yellowish film covering the middle or back of the tongue that persists even after you brush and rinse. A thick, persistent white coating is one of the most reliable visible signs of oral Candida overgrowth, also called thrush, which in adults is almost always a signal that something upstream has disrupted your body's microbial balance. The most common upstream causes are a course of antibiotics that wiped out the bacterial populations that normally keep Candida in check, uncontrolled blood sugar that feeds yeast, significant immune suppression, or chronic use of inhaled steroids. Any of these scenarios deserves medical evaluation. A thick yellowish coating in the center or back of the tongue tells a different story and a more concerning one. Research published in peer-reviewed gastroenterological literature has associated thick yellow tongue coating with gastric inflammation, bacterial overgrowth in the digestive tract, liver dysfunction where bilirubin metabolism is impaired, and even early markers of cardiovascular inflammatory burden. The yellow color specifically reflects the accumulation of volatile sulfur compounds produced by pathogenic bacteria that proliferate when the gut microbiome is severely disrupted or when the liver is struggling to process waste efficiently. If you see a thick yellow coating on your tongue that is not explained by what you just ate or drank, you are looking at a potential signal from your digestive system or your liver that demands your attention. The second sign is a pale, almost white tongue with very little pink color and a smooth, slightly shiny appearance. A healthy tongue is pink because it is richly vascularized, meaning the blood flowing through the dense capillary network just beneath the mucosal surface gives it that characteristic color. When that color fades significantly toward pale or white, it means one of 2 things is happening. Either the blood itself lacks sufficient hemoglobin to carry oxygen effectively, which is the definition of anemia, or the vascular supply to the tongue has diminished, which points towards circulatory compromise. Iron deficiency anemia is one of the most common nutrient deficiencies in adults worldwide and one of the most underdiagnosed because its symptoms, fatigue, cold intolerance, reduced exercise capacity, cognitive fog, build so gradually that people adapt to them and stop noticing. A pale tongue is frequently one of the earliest visible indicators. Vitamin B12 deficiency produces a similar picture. Pale, smooth tongue where the normal, rough texture from the papillae is lost because the papillae themselves atrophy without adequate B12 for cellular renewal. The smooth, glossy surface this produces is called atrophic glossitis, and it is a textbook clinical sign taught in medical school that practitioners rarely take the time to look for in a routine appointment. If your tongue looks significantly paler than it should and the surface feels unusually smooth, you may be walking around with a nutritional deficiency that is quietly impairing every organ in your body, including your brain, your heart, and your immune system. The third sign is a bright red tongue, particularly one that looks inflamed, has lost some of its normal papillae texture, and may appear almost raw or polished in patches. A tongue that turns bright red and smooth is almost always telling you about a B vitamin crisis happening in your body. The B vitamins, particularly B3 niacin, B9 folate, and B12 cobalamin, are essential for the rapid cell turnover that maintains the mucosal lining of the tongue and the rest of the gastrointestinal tract. When these vitamins are significantly depleted, the mucosal cells cannot renew themselves properly, the papillae shrink and disappear, and the raw, exposed, inflamed surface that results appears bright red. This is not just a cosmetic issue confined to your mouth. The same B vitamin deficiency that is destroying your tongue surface is doing exactly the same thing to the mucosal lining of your entire gut, from your esophagus to your intestines. This means your nutrient absorption is compromised at the very same time your nutrient stores are depleted. It is a self-reinforcing spiral that gets worse the longer it goes unaddressed. A bright red tongue can also be one of the first visible signs of uncontrolled high fever, early stage scarlet fever, particularly in children, or in the most serious presentations, a sign of Kawasaki disease, an inflammatory condition affecting the blood vessels that requires immediate medical evaluation. If your tongue is genuinely bright red and you have no explanation for it and it persists beyond a few days, this is not something to observe passively. The fourth sign is cracks, deep fissures, or geographic patterning on the surface of the tongue. Run your eyes across the top of your tongue. A healthy tongue has a fine, slightly rough texture from the papillae, but the surface itself is smooth and continuous. If you see deep cracks or fissures running across the surface, or if you see irregular patches where the coating appears in a map-like pattern with red islands surrounded by white borders, what practitioners call geographic tongue, your body is communicating something specific. Deep, persistent fissuring of the tongue is associated in the clinical literature with several systemic conditions that are worth investigating. Chronic dehydration at the cellular level is one, and this is not simply about drinking more water, but about electrolyte balance and the body's ability to retain fluid in tissues. Inflammatory bowel conditions, including Crohn's disease, have a well-documented association with tongue fissuring. Psoriasis, an immune-mediated inflammatory condition, manifests on the tongue with geographic patterning in a significant percentage of affected individuals. And this oral sign sometimes appears before the characteristic skin involvement becomes obvious. Down syndrome has a well-known association with fissured tongue due to structural differences, but in adults without these prior diagnoses who suddenly develop significant fissuring, the most important consideration is chronic systemic inflammation and immune dysregulation. Research examining the tongue's microbiome in patients with conditions like rheumatoid arthritis has found that the bacterial communities living in tongue coating change significantly in active disease, with pathogenic species proliferating and protective species declining. Your tongue surface is a microbiome, and when that microbiome changes visibly, it almost always reflects a change in the systemic environment that is feeding it. The fifth sign is a purple or bluish tint to the tongue or to the underside of the tongue when you lift it up. This is the sign that carries the most urgent clinical implications, and I want you to understand exactly why. The pink color of a healthy tongue comes from oxygenated hemoglobin in the blood flowing through its capillaries. When blood is fully loaded with oxygen, hemoglobin is bright red and tissue appears pink. When oxygen levels in the blood fall, hemoglobin becomes darker and more purple in color, and tissues that are richly vascularized and close to the surface, like the tongue, reflect this immediately. A bluish or distinctly purple tongue is therefore a visible indicator of reduced blood oxygen saturation at the tissue level, and this has serious potential causes. Chronic obstructive pulmonary disease, where the lungs are no longer efficiently transferring oxygen into the bloodstream. Heart failure, where cardiac output is insufficient to maintain adequate tissue oxygenation. Severe untreated sleep apnea, where repeated nocturnal oxygen desaturations are occurring hundreds of times per night. Peripheral vascular disease, where compromised circulation is reducing oxygen delivery to tissues. A persistent purple hue to the tongue, particularly on the underside where the veins should appear blue but not dark purple, and particularly when it appears in the absence of extreme cold temperatures, is a sign you need to see a physician promptly. This is not the kind of finding you monitor for another few weeks. Poor circulation visible in the tongue means the same poor circulation is affecting your heart, your brain, your kidneys, and your extremities simultaneously. The sixth sign is a black or dark brown tongue with what appears to be elongated hair-like projections from the surface. This looks alarming when people first see it, and the reaction is appropriate because even though the condition called black hairy tongue is medically benign, in most cases, the causes that produce it are signals of serious underlying disruption worth taking seriously. The dark color and the elongated papillae that look like fur develop when the normal shedding of tongue surface cells is disrupted. Under normal circumstances, the mechanical activity of eating, the flow of saliva, and the natural cell turnover cycle continuously shed the old papillae cells before they can accumulate. When something disrupts this cycle, the papillae grow abnormally long and trap bacteria, food pigments, and dead cells, producing the characteristic dark hairy appearance. The most common triggers are heavy antibiotic use that has dramatically altered the oral microbiome, chronic dry mouth from medication side effects or dehydration, where saliva is no longer performing its mechanical cleaning function, excessive coffee or black tea consumption, and smoking. But the research also identifies poorly controlled diabetes and HIV-related immune suppression as causes. What this sign is telling you, regardless of the specific trigger, is that the microbial ecosystem in your mouth has been significantly destabilized, that your saliva production or function is inadequate, and that the normal cellular maintenance processes in your oral mucosa have been disrupted. An oral microbiome in this degree of disarray is not staying in your mouth. Research has established clear mechanistic pathways by which oral pathogenic bacteria migrate into the bloodstream, translocate to the gut, contribute to low-grade systemic inflammation, and have been directly associated with cardiovascular disease, aspiration pneumonia, and worsening of metabolic conditions, including diabetes. Your mouth is not a sealed compartment. What lives in it lives in you. Now, I want to give you the most important message of this entire video because what I just described to you may have created a sense of alarm, and I want to direct that alarm appropriately. None of these 6 signs is a diagnosis. Every one of them is a signal, and a signal is an invitation to investigate earlier rather than later. The most important thing you can do with any of these findings is document them. Take a photograph of your tongue in good natural light today and again in a week. Look for persistence. A single day of unusual tongue appearance means almost nothing. Anything that persists for more than 2 weeks without an obvious dietary or medication-related explanation deserves a conversation with your physician with that photograph in hand. The second most important thing you can do is take a systematic look at the lifestyle factors that drive every single one of these signs. Chronic dehydration drives coating changes, fissuring, and microbial disruption. Poor sleep drives inflammatory changes and immune suppression that shows directly in oral and systemic tissue health. A diet dominated by refined carbohydrates, processed foods, and low-quality fats chronically elevates blood glucose, feeds pathogenic oral and gut bacteria, depletes B vitamins, and creates exactly the systemic inflammatory environment that every one of these tongue signs reflects. Smoking is implicated in nearly every tongue abnormality on this list. Excessive alcohol depletes B vitamins, impairs liver function that reflects in tongue coating, and disrupts the gut microbiome. You do not need a laboratory to start addressing these root causes. You need a mirror, some honesty, and the willingness to act on what you see. Your tongue has been telling you something for a long time. Today, you finally know what to listen for. If this video gave you information that your last medical appointment never did, subscribe, leave a comment below telling me what you saw when you looked at your tongue today, and share this with someone who needs to see it. I read every single comment. I will see you in the next one.